read the agenda that's up on the screen. So welcome to the Students' Alcohol and Drugs Conference of 2021. My name's Odette and I'm helping out my colleague Michelle today, who you all know, because unfortunately she's got a bit of a poorly voice. So thank you all very much for joining us here today. So yes. Hi and welcome to our very first Students' Alcohol and Drugs Conference. We're going to get started in a second, but before we do, just a few tips on getting the most out of the conference. So use the chat box at the bottom of the screen to talk to other attendees. It can be difficult for presenters to keep track of questions in the chat box. So if you have a question for the person speaking, you can submit it using the Q&A option at the bottom of your screen. All sessions will be recorded and shared with you at the end of the day. And we will be using the same link and password for all 3 days. So if you've made it here today, you'll have the information for the next 2 days as well. Make sure you use their hashtag that's on the screen and have fun. So without further ado, I would like to hand over to Ellen Fearon, President of NUS-USI, who will be leading our first session, Drug Harm Reduction, What Does It Mean to SUs and Universities?
Thank you so much, Odette. Hello, everyone, and welcome to the Students' Drugs and Alcohol Conference. I am so excited to be introducing you to our first ever conference to have a specific focus on drugs harm reduction. Over the last 10 years, students' unions and universities have learned so much on tackling alcohol-related harm and building inclusive campuses. Many students' unions and universities have worked hard to change how alcohol-related issues are treated on campus, taking a non-judgmental, evidence-based approach to designing interventions that seek to support and not to scald students. There's still a long way to go, but this step change in the sector has paved the way for considering the way that we treat student drug use and question whether the zero-tolerance approach that most of the HE sector have taken for so long is fit for purpose. Despite decades of our universities taking the just say no approach, NUS's 2018 research and our survey this year have shown that drug use really is, whilst infrequent, fairly common. So NUS and SOS UK believe that a zero tolerance stance is both harmful and damaging, as it prevents students in need of support from reaching out, fearing that they may be punished. It's in the best interest of our students, for students' unions and universities to move away from a moralistic and punitive stand to seeing drugs advice as a key component of student health and wellbeing support. We do, however, acknowledge the challenges in changing attitudes and practices around drugs. To help and guide institutions and ignore the sharing of best practice, we launched our new support and institutional change pilot programme, Drug and Alcohol Impact, in November. This programme builds upon and runs alongside our established alcohol impact scheme, of which many of you, I'm sure, have participated in over the last 8 years. So Drug and Alcohol Impact supports universities and students' unions to work in partnership to get to grips with what student drug use looks like on their campus and to design effective interventions to reduce the harm students who choose to take drugs face. We're so proud of the work that the pilot partnerships at Keele University, the University of West England, the University of Leeds and the University of East Anglia have done so far, and we look forward to hearing from many of the staff, officers and students leading this work in their institutions over the next few days of this conference. I'd also like to take the opportunity now to acknowledge and thank the student organisation, Students for Sensible Drugs Policy, for all the work that they have done to progress the conversation around students and drugs, and we look forward to working with them to ensure that students are listened to and that their needs are met. The countdown to the start of the next academic year is on, and many experts believe that we could see an increase in alcohol and drug-related issues in the new year. Many of the new inset of freshers will have just turned 18 during lockdown, and many of them will be arriving at university with less experience of nightlife and less experience of knowing about their own tolerance as well. And on top of that, many of this year's freshers feel that they have missed out on some of the uni experience as well, and they're looking forward to making up for lost time. So alongside this, we've seen a huge increase this year in students and young people reporting mental health issues during the past year. On top of that, we've also seen the capacity of mental health services being greatly reduced over the years. In an NUS survey in November, we found that over 50% of students reported a decline in their mental health during COVID. And we know from our research as well that some students use drugs and alcohol to help them deal with poor mental health, but this can, of course, have unintended consequences and can worsen mental health in the long run. So we need for students' unions, universities, and our local communities to work together to provide support for students coming back to campus. And we need non-judgmental, effective support for students around drugs and alcohol, and that should all be part of it. We're lucky here at SOS UK to be working alongside some of the leading drug harm reduction organisations in developing our work in this area. So I'm going to hand over in a second to Dr. Laura Garius from Release and also Guy Jones from The Loop to tell you a wee bit more. Following their initial speeches, we'll have a chat with Laura and Guy, so please do submit any of your questions using the Zoom Q&A function at the bottom of your screen. And with that, I'd like to thank you all very much, and I will hand over to Dr. Laura Garius, the policy lead at Release, to hear a bit more from you.
Thank you very much, Ellen. Okay, bear with me one moment while I share my screen. Okay. Are we able to see me and hear me? Yes, thank you very much, Guy. Thank you, Ellen, and welcome to everyone. Good afternoon. I'm Dr. Laura Garius. I'm the policy lead for the charity Release. And I've also taught as a lecturer at a higher education institution as well. So I'm really excited to be able to talk about these important issues at a very key time about drug harm reduction. And what does it mean to student unions and universities? A little bit of background about Release, the charity. We are the UK expert on drugs and drug law, and we have a very proud history of helping people access information and support about drugs and drug harms. And we firmly believe that drug policies should reduce the harms associated with drug use, and the people who use drugs should be treated with dignity and equality. A lot of the work that we do at Release is informed by these harm reduction principles, but today I'm going to be talking about two key pieces of work that we've been doing. One is our policy paper, Taking the Hit, which we wrote with NUS, and we surveyed UK university students and asked institutions what their drug policies were, and I'll be sharing some of the results from that shortly. And another piece of work that we've just published is our Drugs in the Time of COVID report, which looks at drug purchases over the COVID-19 pandemic, including purchases made by students. And again, I'll be signposting some of those results. But first, and just important to say that I'm going to be focusing on illicit drug use and illicit drug harms, as that's the basis of our work at Release. But I know that a lot of great speakers are coming up as part of this conference to look at alcohol-related harm and harm reduction as well. But just to set the scene on illicit drugs and the policy context in which we're working in, whilst there's been a shift in the needle on public opinion about certain drugs such as cannabis and its regulation perhaps, the UK is becoming more punitive with legislation such as the Psychoactive Substances Act, which was introduced in 2016, which criminalised the former legal highs. Thereafter, we saw the Home Office's 2017 drug strategy, which placed a huge amount of emphasis on reducing drug use rather than reducing the harms that may arise from drug use. As well, many of you who are in attendance today will be keenly aware that we are in an epidemic of drug-related deaths. We're having 8 years of year-on-year increases, record highs, including deaths around MDMA and linked to cocaine, which are drugs that I know will come up as part of this conference. And I'm sure we're all acutely aware of the global health pandemic that we find ourselves in as I talk to you via Zoom. And already we're seeing really worrying information about what that means for students in this past cohort and the incoming cohort in September, and what that means for their well-being. And alongside all of this, and the Black Lives Matter movement, which began in 2013, but has really gained more traction following the death of George Floyd and police brutality on both sides of the Atlantic. This runs alongside, and especially alongside the pandemic, and it's looking at the inequality of drug laws and drug law enforcement, and it's a huge part of the work that Release does. So hopefully, by sharing all of this with you, you're convinced that now is the time that we need to be talking about harm reduction in higher education institutions, now as good a time of any. And so that's why this conference is great and looking forward to talking about it. But before we can talk about it, to quote Adam Winstock, who is the founder of the Global Drug Survey, in order to reduce drug-related harm, it's time to be honest about the pleasure. So what do we mean by that? It's time for institutions to recognise that drug use is very common among the student population. We know this from national surveys like the Crime Survey for England and Wales. That repeatedly tells us that students are the employment group most likely to engage in drug use. But this could also be by virtue of their age group. We know that 16 to 24-year-olds have historically been the group with the highest prevalence of illicit drug use. And we also know that it naturally decreases over time, often without any intervention at all. So it's really important to acknowledge that it's very widespread and common, and experimentation is usual for this cohort. But it's also important to know that whilst it's common, it's occasional. Now, this differs by different drug types. So for cannabis, this isn't necessarily the case, but we know that for club drugs, which again will be brought up as part of the conference, we know that often this is special occasion, less than once a month use. There are many number of reasons, as I'm sure you're aware, of why people would use drugs, and we have to realize that these reasons can include enjoyment, relaxation, to facilitate social interaction, especially for students moving into this new space, trying to make friends. It can be a really kind of positive thing to use drugs. And that's something I really want a key message to be from my talk today, is that there are positive and negative effects from drug use. So it's very redundant to focus on just negative effects for people who use drugs as something to be eradicated. For many users, there will be a huge amount of positives associated with their drug use. And following on from that, we know that problematic use, so the development of a substance use disorder, is extremely rare. It shouldn't be ignored. It's definitely a risk and something that should be supported if that individual wants that support, but it is very rare. Global estimates say less than 10% of people who use drugs will develop problematic drug use, so a dependence on drugs. And hopefully that's again convinced you that zero tolerance policies are unrealistic. They ignore many of the reasons that students would use drugs and how common this has been. And universities that are trying to achieve a drug-free university or drug-free campus is not realistic and can actually be doing a lot more harm with the environment that they're creating. So I want to share some results from our Taking the Hit report. This was published in 2018 alongside NUS, as I say, and we surveyed 2,810 UK university students and received freedom of information requests from 151 UK higher education institutions about their drug policies. And I want to share some of the findings with you. What do we find from our student survey? We found that 56% of students surveyed said that they had used drugs. So what we're seeing here is that it's the majority of students who had or will use drugs. So as I said, very common. 80% of those who'd use drugs said they do so recreationally. 31% of the students sampled said they had used drugs in times of stress, and 22% said they had used drugs in order to self-medicate. Now, what the tendency might be for some institutions seeking to justify a zero tolerance approach is that they may focus on those last two statistics there as their kind of rationale for a drug-free campus. However, building on what I was just saying about the positive effects, for the minority of students who are using to self-medicate to address past traumas or present stress, actually their drug use can be a positive thing for them. And to simply remove that and not address the underlying mental health issues or the stress could be extremely harmful. The findings from the student survey that worried us instead were the following. We saw that students who use multiple substances, of those students, 18% were mixing cocaine and alcohol together, which can make a very toxic substance, cocaethylene. And so that's a concern for us, how students are not being taught or told not to mix those two substances together. Something else that was a concern was that 51% of students did not know their institution's drug policy. 40% of students, furthermore, did not want to disclose their drug use for fear of punishment by their institution. And it gets worse because 26% of occasions where student was found in the possession of drugs, personal possession, the institution reported them to the police. And I know this will come up throughout the panels, but this is not an obligation of the university to report student drug use to the police. So that was unnecessary. And I think it's Jess Bradley from our Taking the Hit report summed this up really well, that punitive measures rarely help and they make our educational institutions complicit in the practices that prevent marginalized and potentially vulnerable, not always, but potentially vulnerable students seeking help. So the punitive approach can be harmful. What approach could be taken? So now looking at the responses that we received from those 151 institutions, what would they do if a student was found in the possession of drugs? The good news is that over half of the institutions said that taking no further action, an informal resolution was an option for them. So that's good, although we don't know how often that's employed. But there was a suite of punitive, formal disciplinary measures that could be taken for the personal possession of drugs, and I shall show them to you now. These included formal warnings, temporary or permanent exclusions. We know that the impact that can have on a student's educational outcomes and the stigma and shame that is associated with that is, can't be underestimated. Here we have it, 68% of institutions said that they would they could have the ability to refer their students on to the police if caught in possession of drugs, which, as I've already discussed, is not an obligation. This can cause lifelong harms to employment opportunities, travel opportunities, etc. Another option in the arsenal of formal disciplinary measures is the eviction from student accommodation. If we're thinking about the evidence, this seems extremely counterintuitive because whilst we know that problem drug use, dependent drug use is rare, housing instability is one of the major factors of that problematic use. So this seems extremely counterintuitive to throw a student out of their accommodation. Not in as many institutions, thankfully, but we do see that some institutions have mandated treatment, drug treatment courses for their student to be able to stay on at the university. And again, if we just look to the evidence out there, we know that coerced treatment rarely ever works. Treatment should be voluntary, and we should meet people where they are in their drug use journey if they want treatment. And finally, again, this is less common, but some institutions had additional surveillance measures, so drug student swab testing or sniffer dogs. Again, looking to the evidence, we can see that the presence of sniffer dogs is not an effective deterrent and in some cases can be really harmful. Studies have shown that young people consume their drugs much more quickly in the presence of drug dogs. And also there's a tendency, if drug dogs will be present, for students to choose to use drugs that they perceive will be less detectable. And some research in New South Wales showed that this tended to be drugs like GHB as opposed to cannabis. And we know that if misused, GHB can be really quite dangerous. Something else we found was that a lot of institutions, over half, were formally disciplining students for actions that are not considered a crime. One example I'll give is the possession of nitrous oxide, laughing gas, which is not a crime under the Psychoactive Substances Act 2016. So we know that those actions can be really harmful, but something else that institutions have to understand is that these harms are not equitable. Something that we focus a lot of our efforts at and attention to at Release is the disproportionate drug laws and drug law enforcement. And we know that this is imposed most harshly against ethnic minority individuals, despite prevalence among these groups being no higher than among the white population. We see, for example, that ethnic minority individuals are overrepresented in stop and search statistics, particularly talking about individuals from the Black community here. And also this then feeds into disproportionate criminal justice system that we find ourselves with today. Academic institutions need to realise that the risk of detection for drug use is not equitable between ethnic groups. And then furthermore, the risk of punishment and the severity of that punishment is not equitable. Taking one example of something we've been looking at is Crown Court sentences for drug offences. And if you look at the sentences for Black women against their white female counterparts for the same drug offences, they were 25% more likely to be sentenced to custody. So it's really important that we see and realise what's happening. As well as that very disturbing overrepresentation of ethnic minority individuals in the justice system, we see that they are underrepresented in treatment. So looking at the National Drug Treatment Monitoring System, we know that ethnic minority individuals are underrepresented there. Now, this, again, problematic use is rare, but should we really be surprised that there are barriers for ethnic minority individuals in gaining treatment because of that fear of discrimination, prejudice, and that punishment they have seen historically over and over again that continues today? So the two are definitely related, and that is something to bear in mind that your ethnic minority individual students may be feeling as well. We all know as well that we're in a very unusual situation right now with the COVID-19 pandemic. Some of the NUS Coronavirus and Student Survey 2020, those results show that over half, and Ellen referred to this, over half of students have seen their mental health worsen since the start of the pandemic. Again, looking to the academic literature itself, we know that isolation is a key driver of problematic use when it does happen, though rare. If we look at animal studies, for example, if you look at socially housed animals versus isolated animals, the isolation is key in their compulsive drug use and even in their overdose rates. What does this mean for students who have come to university and are isolated in small rooms and aren't able to socialise? So it definitely is a legitimate concern. One quote from our own coronavirus drug purchases survey. This was one student respondent. I quit MDMA over a year ago, but lockdown is driving my mental health backwards. So we definitely know that this is a valid concern, albeit that problematic use is rare compared to those who use not problematically. This is a real advert from our drug purchase survey. The survey is still live. Our first report looks at the first national UK lockdown, but subsequent reports are going to focus on lockdowns 2 and 3. So that survey link at the bottom there is open, and I'd be very pleased if people completed that every time they complete a purchase. But the survey that we're running, and we've been running it since April 2020, is transaction-based. So we're asking people about any drug transactions that they have made since the start of the pandemic. This is directed at 18-plus-year-olds residing in the UK. The report that we've recently released looks at 3,000 almost responses between April and September, that first UK national lockdown, and 20% of that sample were students. So what we've done today is drill down into those students and look at whether there are any harms that we're seeing from our perspective and what we can expect for the new cohort moving forward. I do just want to give a caveat, the limitations. There are obvious limitations associated with online surveys. Not everyone will have access to them, but for the student sample, we expect this to be quite ubiquitous. But we didn't explicitly ask to specify if they were in higher education institutions, but given that this is 18-plus-year-olds indicating they are students, we would expect that this would be the vast majority. So having said that, let's have a look at some of the harms that our student sample in our survey have seen since the start of the pandemic. So students were asked since the start of the coronavirus pandemic, what harms have they seen? Have these harms reduced, stayed the same for them, or increased? We see there, first of all, that overdose, and by this we mean non-fatal overdose, by virtue of them responding to our survey, of course, that 41% of students had overdosed more frequently compared to before the pandemic. So they were overdosing more frequently. 48% had increased contact with the police compared to before the pandemic. This is something that's really worrying to us at Release. We see that stop and search increased over the pandemic, which we would have expected it to go down. It's increasing despite everyone meant to be social distancing, so it's highly alarming. And 54% of our students in our sample said that they had increased withdrawal symptoms since the start of the pandemic, which can be very unpleasant, and in some cases, for example, alcohol, benzodiazepines, it can be very dangerous. Even though this was a transaction-based survey, so we were asking people about the purchases they made, we couldn't help but ask about use at the same time. When they were making a reported purchase, we wanted to ask what's happened to your use since the start of the pandemic. We asked students, in this case, since the start of the pandemic, has your use increased, stayed the same, or reduced? And what you can see there is the most popular response is that their use had increased. 45% of our student sample said their use has increased since the start of COVID-19. And that is really interesting because obviously there are unprecedented disruptions to the drug market because of COVID-19. We see law enforcement have increased stop and search rather than reduced it, and yet still use is ongoing. So this is an issue that will not simply go away. We need to provide measures to reduce the harm from drug use, and especially if we're anticipating an increase in drug use that's problematic and negative in the coming months with our student cohort. What do we think you should do? But we're going to hear today about some amazing examples, as Ellen said, from institutions who have been leading on the front of harm reduction. So I won't go into too much detail at this point, but we think at Release that something all institutions should do, if they're not already doing so, is reconsider the formal disciplinary measures that I've already hopefully convinced you are causing a lot of harm and more harm than good. So reconsider the formal disciplinary measures. And my colleague Steve and Kata, who's also with Release, will be talking in a panel with Hannah Head on Wednesday about where is the line, what can institutions do, and what is their obligation. But something that everyone can do is reconsider those disciplinary measures from the off. Also, institutions should provide tailored, expert, practical advice and training. Why have I emphasized practical there? Because a lot of the support available is tailored towards problematic use and dependency, whereas we've already seen that for the vast majority, that is not an issue. And so actual practical harm reduction advice about, Ella mentioned your tolerance may be lower if you've had a period of absence over the university holidays, etc. What not to mix, alcohol and cocaine, and training as well. So those who are offering support should be specifically drug trained, and first aiders should be trained as well in drug harm prevention. Of course, though, we have to recognise that routes to support must be provided if they are wanted by that individual. They should never be mandated, and we need to meet people where they are, as I say, on their journey. There should be a suite of harm reduction measures provided, because choice is really important as well, and this should be guided by harm reduction experts like the Loop, and I know Guy is going to be talking after me. We would advise, although I'm sure Guy will talk a bit more about this, that drug checking is rolled out across universities, be it, you know, the system that Guy would like to talk about, or if it's even if it's reagent testing, which we know has some limitations, but we really would encourage universities to roll this out as soon as possible. We also believe that institutions must conduct equality impact assessments on any procedures and responses that they are taking in response to student drug possession or even student drug supply. It needs to be a holistic approach. So it needs to be that all staff from, you know, doormen, lecturers, the students themselves understand the institution's drug policies and what can and can't happen if a student is found in possession of drugs or beyond. And it shouldn't be tokenistic and reactive to tragedies that occur, and these are tragedies, then we should be seeking to prevent them and not react to them. Let's prevent them. Obviously, any kind of harm reduction intervention needs to engage with students themselves, who are the experts by experience, and students who use drugs, they are the experts in what they need. Obviously, with our students' unions and organisations such as Students for Sensible Drug Policy, who I know are speaking as well as part of this conference and weaved throughout. And the efforts can't stop because students have been so instrumental in a lot of the great movements we have seen in the handful of institutions who have been really forward thinking. That can't end when those students graduate. We need to keep this momentum going. And another thing that is often not considered is that universities should engage with expertise within their own institution. You have an untapped resource of academics with probably a great deal of expertise about drug policies and drug-related harm, so tap into that when making your policies. And you need to learn from, as we all will as part of this conference, which is why it's so exciting, learn from harm reduction forward institutions. Great examples coming up today from those pilot projects, but just thinking off the top of my head, Bristol and their project with the drop, a very holistic approach, and also informed by the Loop. So that's what we need to do. To end my talk this afternoon, I just want to share a quote by our friends at Harm Reduction International. They describe harm reduction policies and practices are informed by a strong body of evidence that shows interventions to be practical, feasible, effective, safe, and cost-effective. And so what I want to kind of say when I'm thinking about what harm reduction means to student unions and universities is that harm reduction can mean that we move away finally, and I know many institutions here have done so, but for those who haven't, move away from those archaic, moralistic, ideological policies and actually move towards evidence-based practices, which is the least we would expect from these bodies of learning, these institutions of learning, a commitment to evidence, and that's what we want to see. But it's also an amazing chance to be at the forefront of reversing, and this is a lot of the work that Release does, reversing the harms from our existing drug policies and drug laws. How can higher education institutions be part of solving and minimizing those harms from our drug laws? It's also a really exciting opportunity to commit to social justice for some of the reasons that I've discussed previously. And finally, it's a way for universities to commit to the duty of care that they have to these students who come at a very vulnerable kind of transitional time in their life potentially, and this is time to honour the duty of care. And for students and students' unions, it could even mean saving lives, which is the ultimate goal of harm reduction, but it could also mean fostering a positive environment whereby students are able to share their drug use without the fear of punishment, and if there are any problems with that, that they can be shared as well without that fear. So thank you very much. I will stop sharing.
Amazing, thank you so much, Laura. I think just a lot of really valuable, important and informative information and thoughts there, and I'm sure some of our attendees will have questions on your presentation later as well. So next up we have Guy Jones, who is a senior scientist at the Loop.
Good afternoon. Thank you very much for the introduction, Helen. I trust that you can see the presentation and hear me and see me well. Fantastic. I will begin. So my name is Guy. I'm a senior scientist at the drug checking organisation, The Loop. I came into this world of harm reduction through my volunteer work with SciCare UK, which is an organisation, a charity that goes to music festivals and runs what we call a sanctuary space. And I also run Reagent Tests UK, which is a company that manufactures and sells the home drug testing kits that some people use prior to their drug use. So I first want to kind of cover how I understand harm reduction to contextualize what I'll be talking about. Now, harm reduction is a very well established technique. You've heard the term a number of times already today. It's something that doesn't just apply, of course, to drug use, but to any risky behavior. Certainly, universities will be very familiar with the application of harm reduction techniques in safe sex. But anything extreme sports, motorcycling, you name it, where there is risk and people engaging in risk, we can apply harm reduction techniques to try and reduce the risk that they are exposed to. And the aim is to try and modify that risky behavior and in a way that accepts that we are not going to be able to eliminate harm. Abstinence is absolutely a great strategy for some people. And of course, that's going to mean that they are not going to engage in that risky behavior and they will not be exposed to the harms, but it's not appropriate for everybody. Some people will not maintain abstinence, and harm reduction is about accepting that and being pragmatic about it and thinking, okay, how can we reduce the risk that these people engaging in risky behavior are exposed to? One of the things that we constantly keep in mind with the Loop, and I'm sure will be the case with universities as well, is funding is not unlimited. And we're always needing to work within the limitations of what we have available to us at the time. It's all good and well saying that we should have a doctor supervising every house party, and anybody who wants to can come up and ask them questions, and they'll have a state-of-the-art laboratory set up in the bathroom. But the reality is that does not, cannot, and will never happen. So we need to think about how can we use the resources we have available to us to have the greatest impact possible with those limited resources. And so we're just thinking about how can we reduce the frequency with which people encounter risk, and when they do encounter risk and negative effects do occur, how can we reduce the severity of the impact of that behavior? And so it's with that I'll introduce to you the Loop. The Loop is focused on reducing harm and enhancing health and well-being through the nighttime economy and leisure industry. Now, what that means in practice is that we spend a lot of time at music events, particularly music festivals, operating a drug checking service. We are a volunteer-led organisation. Basically, everybody is a volunteer. And you can see one of our wonderful teams at an event in Bristol in 2018 in the image below. And of course, as a non-profit organisation, we're not here to try and make money. This is something that we do because we really absolutely passionate about it and really see the difference that it is making to people who are able to engage with the service, and also to the broader population that it's able to reach out and have an impact on. So how does the drug checking work? What does even really drug checking mean? There are many different types of service, but the way that the loop operates in a music festival is that a service user can come to the service with a substance of concern, and they present to us their expected substance. They present to us their substance, they put it into a bag, and they then give us a little bit of information about what is the substance they expect this to be, whether or not they have already consumed it, and if they have consumed it, what the effects are. We asked them about the expected substance, or more precisely, what it was presented as, because we may find different trends in substances that are sold, in substances that are gifted, and in substances that are found on the floor. Indeed, as you might expect, substances that are found on the floor have a vastly higher probability of being complete rubbish. And we have a sneaking suspicion that people are likely, once they have tried a substance and found it to have undesirable effects, throw it away. And it's no secret there's a litter problem at festivals. So we also then ask whether or not they have tried it, and if they have, what the effects are, because that also gives us information about what the potential identity of the substance is. If you recall, we're working with the resources we have. So what we don't want to do is receive a substance that somebody's already consumed. They think it has no effects, and they just want a confirmation of that. If we don't have that information, we may spend an hour or two doing increasingly detailed analyses to try and find some sort of trace material that could be a drug in there. And we eventually find the answer is no. We feed that result back to them and they say, oh yeah, thanks, that's what I thought, I didn't get any effects either. If we've got that information early on that they've said it's got no effects, we've done a couple of analyses and those have also revealed that there's nothing we can find, then we're going to be able to cease the analysis of that sample. And the important part here is to move on to the analysis of another sample. So it's not about saying, no, can't be bothered with that. It's about saying, okay, we understand the risks associated with this sample. Now we need to move on because we've got another dozen samples that we need to get through in the next 10 minutes. So once the sample is submitted, it's put into a locked amnesty box. And every 15 minutes to half an hour, that is transported to the lab. Once the sample has been deposited in that amnesty box, the service user never sees it again. And that's communicated to them up front. So they're obviously clear on that. But this is a key point, that the sample of concern is not handed back to the service user at any point. So the lab analysis, as I mentioned, uses a number of different techniques. And this is routine in any laboratory that operates, because there will always be small blind spots in any testing method. And by combining different methods, we have the ability to cover those blind spots with a different technique. With our fastest analysis program, we can run a sample within 10 minutes. And that, of course, depends on what the sample is and whether or not we've got any backlog, which we often do at busy events. And with our most detailed analyses, we generally tend to be able to manage things in under an hour. And so what we say to people when they drop off the sample is, please come back in an hour to collect your results. Once the analysis is finished, the chemists in the lab will kind of finalize and submit a sort of one-sentence report that will be fed back to the front of house system. And the important bit there, the reason that we don't need to do a great printout, is because at the information return stage, everybody volunteering in that area is a healthcare professional. So we have doctors, nurses, social workers who already have some existing expertise from their job. And then the loop provides to all its volunteers additional training to really bring them up to the standard of absolutely a drug expert. Somebody who is a GP in their day-to-day life may well have a little bit of understanding about drugs, but they are not necessarily going to have the in-depth knowledge about how to reduce risk when consuming MDMA or an obscure research chemical like 25I-Mbone. And so that's what we try to bring people up to, that standard. And then we also, of course, have the ability for our volunteers to collaborate with each other. So people who do have special expertise on certain substances or substance groups will be able to confer with their colleagues to help them communicate the risks appropriately. The risk communication that we give, the what we call a brief intervention, is not just about returning the test result though. And this is a really important point. We have this fantastic expertise that is returning the result. It would be a great waste to simply report back, yes, your substance was MDMA, it's pretty strong, good luck. What we actually do is that the consultation takes about 15 minutes, and it follows a process. So we ask a little bit of demographic information to help us to understand who is our service reaching, who's benefiting from this, and who is not able to use the service. Certainly when we're operating at a music festival, that is something that is only available to people who have got £200 to spend on a music ticket. We're obviously not going to reach extremely vulnerable populations doing that. Conversely, if we're running a testing service in a city centre, as we have done a number of times in the past, if we don't market it effectively, if it is too far away from typical student areas or too far away from the demographic of people that we're aiming to reach, they may not decide to come and engage with the service. So that's why we collect demographic information. We then ask a little bit about the person's situation, their background. Do they take any medication? Are they planning to consume any other drugs that evening? Particularly remembering to ask them about cannabis and alcohol, which some of them will absolutely overlook if you just say, what other drugs are you going to consume? And so the healthcare worker then uses that information when they give the result back to present in context what is the substance that was analysed, and what does that mean to the service user? How is that going to affect them differently from what they expected? How is the medication that they said they were taking going to have an impact? Really trying to use that small window of time that we have available to present them with the 2-3 most important things that the healthcare worker thinks, all right, what can I tell this person that is going to most reduce the probability that this person ends up in the medical tent or in A&E as a result of using this substance? And what we find is that service users come in expecting to kind of begrudgingly trade their attention span for 15 minutes for their test result. In practice, we often have to kick them out after 30 minutes because they are so receptive to being spoken to like an adult by somebody who accepts the reality of what drug use is, going back to what Laura said, who doesn't pretend that there is no positive side to their drug use, who doesn't say, well, here's all the horrible dangers of this drug that you're about to take, and I hope you don't take it because that just sounds terrible. It's about saying, you know, you're at a music festival, you're planning to take drugs because you are finding that an enjoyable experience. Here is the win-win situation that you can do that is going to allow you to still have that enjoyment, but to also reduce the chance that you're going to end up in the medics or the welfare tent or worse. So that's one of our kind of key goals with the drug checking service. Is it's an engagement tool with people who may not normally who may not have even ever come into contact with a drug outreach service in any context whatsoever before. In fact, we have the opportunity to engage people before they've ever taken drugs in their life. And that is a really, really pivotal point, that we can modify their behavior to reduce the risk that they are exposed to. So to hop back up to the top bullet point there, yes, our goal here is to try and use the drug checking service to reduce harm. And certainly in all of the festivals and events that we have data for, we see that there is a consistent year-on-year decrease in drug-related medical admissions, particularly off-site ambulance trips, as the uptake of the service increases year after year, because of course, the first time we're at a festival, many people may not be aware that it is operating. So we also have this goal that we're delivering a highly focused education provision. So we're really pinpointing what this person does not already know and glossing over the things that the healthcare consultant has establish that they are already aware of. We're not going to rehash the issue of managing careful hydration with MDMA if the service user has indicated that they are already aware of that risk. Instead, we might focus on, okay, you've said you're going to combine it with this drug, and are you aware that there's a particular additional risk that is such and such? And by doing that, we further improve the receptivity of the service user to the information we're giving, because they really feel like they're learning something and it's being tailored to them, because it is. Of less relevance to the service user, we also have the ability to conduct drug market monitoring. This is something that allows us and allows the authority commissioning the service to have a better understanding of what drugs are currently on the market, and therefore to have a better understanding of the risks that might be presented by that. And following on from that, we can then issue broader reach risk communications, which think about, okay, there is a sample on the market which presents a particular increased risk to the population that we're trying to reach. And so we'll issue a risk communication about that. You can see on the right-hand side of the slide, and a risk communication from a music festival where we found 2 designs of blotter that did not contain LSD. And we find that off the back of many of these types of risk communication, we can have people who did not engage with the service and were not planning to engage with the service will come to us and ask to use our drug disposal bin because they have a sample, a substance that they now understand presents an additional risk. There are many people who use drugs who believe that that is entirely compatible with taking care of themselves. And I would argue in many cases that is. And they do not want to consume a drug that presents an unusual, unexpected or unpredictable risk. And so once we issue a communication like this, it's quite possible to get them to come and engage with the service where they previously weren't planning to. And we can reach thousands or even potentially tens of thousands of people, depending on the social media reach of the services and organizations issuing these kind of communications. So there are, of course, other models of drug checking that exist. The Loop is certainly not the only drug checking service in operation, not even in the United Kingdom. There is the NUS-USI mail-in service. Samples can be posted in and it takes between 2 to 3 weeks, and they conduct a more in-depth lab analysis. And there are services in Europe that have been operating for over 20 years. So we take expertise from them. And there's a lot of different ways to do it. So samples could be dropped off in a pharmacy and then the results fed back through, particularly nowadays, over a video consultation. There's the opportunity to do a personal handover, to come back a few days later to an office. And something that Laura touched on is the possibility to do at-home testing. Drug checking isn't necessarily something that has to be done in a laboratory. Certainly, by having access to that expertise of the chemists and the healthcare workers, you can operate a highly effective service in a way that you would not be able to do relying only on the expertise of the service user. But at-home testing is one of the methods that can be used to rule out some of the most easily detectable and easily preventable risks. If you've got a substance which you believe to be substance A and is actually substance B, then a simple at-home test is extremely likely to reveal that to somebody. It's a simple case of placing the test material onto the substance and observing the color change. And if the color change is not what was expected, then you've immediately averted a situation where there's an expectation of one drug and you end up having the effects of another, which can be a fatal mix-up in some cases. Supervised analysis is another possibility. So certainly in Canada, this is operated where the service user comes and they do all of the physical manipulation of the sample onto the testing equipment, and then the chemist helps them to interpret the result. And that allows the service to be run in a way where the service can be absolutely confident that there is no transgression of the Canadian drug laws. And there's lots of different settings that can be operated in as well. So there's some thought that can be given to the question of what does drug harm reduction mean to students' unions and universities? What how would this service be operated, understanding the special limitations, the funding constraints, the various different contextual issues that might arise in a setting where the students are being offered this service. So we'll cover that in the panel, and I'd welcome any questions.
Thank you so much, Gary, for sharing your experiences and again some incredibly useful knowledge within your presentation. So we are now going to move on to a Q&A with Laura and Guy. I am going to start, but if you have any questions you would like to be asked, please do submit them using the Q&A function at the bottom of the screen rather than using the screen or the chat box. I noticed that a few of you have already been asking questions, so please continue to work away and we'll try to get to as many questions as possible before we wrap up at past. So I suppose, first of all, I would like to ask you both, and I think that you've both touched on this in your presentations, but just if you have any more thoughts to share, how would universities and students' unions taking a harm reduction approach benefit students? And I'm happy for either of you to jump in, whoever wants to go first.
I'll jump in and give Guy a rest after that brilliant presentation.
Thank you.
You're right, Ellen, we've already kind of touched on it, and I think, this is one of the most important things, and although, this is relatively rare, but it really could save a student's life, overdose or any harmful effects, and that's what, some of the drug checking is aiming to reduce and prevent. But aside from that, which is I think I described it as the ultimate goal of harm reduction, is to save lives. But more than that, we would see a harm reduction approach as more of that holistic approach to a more open, non-judgmental, positive environment. It's kind of doorway in to allowing spaces for students to talk about their drug use, which may or may not be linked to any other issues. In many cases it won't be, but if it is, if there's a positive, open atmosphere where students can talk about their drug use or check their drugs, as Guy said, that could open conversations that they weren't previously having and could expose them to harm reduction information that they wouldn't have considered before. And I think it would hopefully make a much more enjoyable and safe experience without that fear that your own institution will punish you or direct you to the police when it's not necessary.
Yeah, I think there's definitely, so there's clearly harm reduction as the kind of clinical definition. And then there's also thinking about, from the student's university experience, how a university having a harm reduction approach impacts that whole student experience. Do I, as a student, feel like my university is on my side and working in my best interests? Or actually, is there some kind of conflict here between what I believe my best interests are and how the university treats me when they find out that I have either a problem or not a problem? But generally the idea behind kind of punitive measures are, well, the university is saying you've got a problem and therefore we're going to treat you in this way. What is that treatment going to be?
Yeah, perfect. Yeah, thank you both so much. Okay, so the next question, and this is definitely an interesting one. Do universities have a legal responsibility to take a zero tolerance approach?
I'm happy to speak to that one. Although, disclaimer, I'm not a lawyer, but we have brilliant lawyers working for release. And as always, want to signpost Stephen and Hannah Head's session on Wednesday. I believe it's the first session. Correct me if I'm wrong, Ellen. In short, no. So there are legal obligations associated with the premises, although in summary, there's not a requirement, there's certainly not a legal requirement to pursue a zero tolerance policy. So Stephen framed it as, the controlled drugs and psychoactive substances interact with the legal responsibilities, but no requirement to take a zero tolerance approach. There's a lot of flexibility in the criminal law for all of its flaws. And there's no, and this is the key one, and I mentioned it in my talk because this may even be a surprise to some, there is no legal requirement to involve the police if a student is found in possession of a drug or even if they're suspected of supplying drugs. It's all really about the premises and things that I shan't get into because I'll get myself in a pickle. But I know that Stephen and Hannah's session is going to look at very specifics, about what criminal liability is and is not for the institutions for certain different offences. But the overwhelming kind of message here is no, and there are some legal considerations, shall we say, around what's permitted on the premises in terms of smoking, these often relate to. But there's a lot more flexibility than one would think, and it's certainly not, we would actively discourage universities handing their students over to law enforcement when it is not necessary. There are other measures that can be taken, and none of those measures have to involve the police. There are other disciplinary measures, although again, we would prefer that that wasn't involved. And something we like to think about is the police would be involved if something had really gone wrong. And I'm talking about those really tragic cases that we do hear of. Let's engage in harm reduction so that the police do not have to ever be called for our students, is what I would say.
Okay, perfect. Thank you so much. Guy, do you want to jump in there? Or are you
I don't think I could add. That's very much Release's area.
Perfect. Okay, so I suppose the next question, and I'm sure this is something that you maybe come up against quite often, is taking a harm reduction approach the same as condoning drug use? So how do you sort of take that argument and explain that that's not the case? Guy, I don't know if you want to jump in there.
I mean, it comes back to my definition of what harm reduction is. It's about accepting the reality of what happens on campus in society. And the reality of that is that an abstinence-focused approach is not appropriate for the vast majority of people. Yes, we can eliminate risk by making sure that people do not engage in risky activities, but the reality is that humans take risks all the time. It is one of the fundamental things that we do. It's a part of evolution that organisms take risks. And some of those risks go badly, very badly, and some of them have a positive outcome. And so if we say, no, the only possibility here is that people don't take drugs, then as far as I can tell, that is doomed to failure. So harm reduction is about saying, what is the reality? What's happening here? What is our duty of care to our students in this case? And how can we act in their best interests? And for me, it's not about whether or not you're condoning use or condemning use. It's entirely unrelated to a moral stance on it. It's about saying, how can we keep people safe?
And I think that was perfectly phrased, guys. I can't really build on that, but exactly that. And again, that on being honest about the situation, how common it is, and to be honest about the pleasure, as Adam Winstock would say, the zero tolerance, the abstinence space is not going to work. And some who maybe fear that this would be perceived as condoning it would say that what we're doing is creating a climate where there's an expectation that students would use drugs, where we're encouraging it, and that's not the case at all. In our survey, for example, in taking the hit, a huge proportion, I think it was 88% of students did not feel any pressure to engage in drug use. So that's not going to change if we adopt a harm reduction approach. And also, a lot of universities who have embarked on this, some of which are speaking at this event, but a lot of universities that will have in their harm reduction statement very visible student facing that they don't condone drug use, but we realise that this is extremely common, and we would much prefer that we protect you and we put kind of health and life above this moralistic ideological view that is very archaic and outdated. So even within universities' harm reduction statements, you can even phrase that we don't condone, if that's your concern, that is how it would be perceived. But it's far more important to engage in these policies that are evidence-based. That's a massive confusion as to why more institutions have not got on board is that the evidence says that this is what we need to be doing and that this is really the opposite. The punitive approach is extremely harmful.
Okay, perfect. Thank you both so much for those insights. So I'm going to ask one more question and then I'm going to jump over. We have a lot of questions coming in from attendees. But first of all, I want to ask, do you have any examples that you want to share of what good harm reduction interventions look like?
I think I'll pass to Guy on this one because Guy leads an excellent example.
I mean, am I biased if I say the loop? Yeah, I mean, certainly my experience is through working with the loop, and I have seen firsthand how effective that is, and I have seen through the research publications that the loop publishes in peer-reviewed scientific journals how effective that is. So clearly there is a huge benefit from running something like that, but that's not necessarily going to be something that every institution wants to or has the ability to operate. And it certainly isn't and shouldn't be the only way that we tackle the harms related to drugs. Harm reduction is all about, maybe not all about, but certainly one of the things that needs to be considered is that there is no single one thing that you can do that just is it. You can't just say, well, a really good example is what a lot of people who have never come across drug checking believe it to be. They believe it to be that a sample is submitted, a result is given back, and it says, your drug was MDMA, thank you, good luck. Clearly, that is a drug checking service, and clearly there is the potential to reduce harm as a result of that, but it would absolutely not be appropriate as the single and only thing that a university offered as a harm reduction technique. So I think by combining different effective techniques, we can have a much greater coverage and a much greater impact with the harm reduction service than by simply offering just the loop service.
Perfect, thank you. And no, I don't think that's biased at all. I think the loop did excellent work, so you should rave about it as much as possible.
Thank you.
Okay, so one of the questions coming in from one of our attendees is, do you think that some subject areas, mostly medicine-based subjects and courses, are justified in being more harsh on drug use to students?
Oh, that's a great question. So there are, and in taking the hit, which I really do recommend everyone has a look at, we do cover the policies for the fitness to practice. So we wouldn't say that you should, they should be treated more harshly, but we do recognize that there are some cases in which it will impact your fitness to practice. But what we'd recommend here, and some institutions did this, is that maybe instead of mandating treatment, which is not necessarily what people may need, but some institutions mandated educational courses in those cases, where someone on a course that did require, the fitness to practice was caught in possession of drugs. So we would be more in favour of mandated educational programmes, because maybe that could speak to the 80% plus who are using recreationally rather than having a problem with their use. So I guess that would be my response to that, but we still would not argue for exclusions, evictions, referring them to the police, or any of those other harmful measures.
I think for me, it comes back to what is in the best interests of the student, what is going to help them move forward with their life in a way that their drug use doesn't have a big negative impact. If somebody is an occasional user of cannabis and they are caught doing that, is there really going to be a great positive impact from referring them to the police for cannabis possession? Or actually, is there a different approach that can be taken? Does being more harsh to a student of medicine in that situation create a bigger positive impact? I would argue no.
Yeah, amazing. Thank you both so much for that. Okay, so next I have a question specifically for Guy and then a question specifically for Laura as well. So Guy, I'll start with you. So sort of two questions here wrapped into one. What sort of numbers of individuals are using the drug checking services at festivals? And then as well as that, do you have any success in getting drug testing at student union bars and clubs? And do you deal with much resistance from venue managers with the likes of that work?
Numbers at music festivals varies significantly. At our busiest events, we can handle, on our single busiest day in 2018, we managed over 500 samples in a day. And it is an absolute testament to the speed and efficiency of the lab staff that we were able to do that. At our quieter festivals, we can, at the very quietest festivals, it might be single digits on some days. So it depends on a number of factors: the size of the festival, the prevalence of drugs at the festival, the effectiveness with which the service is marketed. Where the service is located has a huge impact. If we are stuck up at the back of the furthest campsite in the middle of nowhere, people ain't going to walk. So if we are in the middle of the kind of main strip where there's vendors and people stumble across the service because many of them will be unaware it's there, then we can be literally queuing out the door. And we find that in some situations at that busiest event, we are even then limited by the capacity of our service. We are working to our limits. People are queuing for an hour to collect their result. And we know that that causes people to be turned off from submitting a sample. So yes, it can get pretty big, but it could be bigger. As a nascent service, we are thinking about how to increase our capacity and build and scale as an organization. With regards to student union bars specifically, we've not operated in any such venue, nor have we operated in any specific bar. And the way to think about this is, by doing that, we are really limiting how far we can reach. We are, especially in a bar, at a music festival, we run the service from generally 10 until 7 p.m. And we cut off at that point because, first of all, much as I sometimes wish I could, we can't work 24 hours a day, not without some huge volunteer team. And practically, we need people to be sober and in a state to understand the information that we're giving them. And if we're operating in a bar that opens at 7 o'clock, it may not get busy until 10 o'clock. We really have a very narrow window to reach people. So it's much more effective for us if we can somehow find a way to operate the service as we did in Durham in 2018. In a city centre location during the daytime, so that people can go there during the day, get their drugs tested and get the result long before they have begun their process of intoxication. As for whether or not we have pushback from venue owners, generally, and I would say this is for festivals, bars, etc., the people who run the venues are overwhelmingly positive and really, really want us to be there, because they absolutely have the best interests of their patrons at heart. Where we see pushback is generally, it can be fear from the venue owners about how having a drug checking service will be perceived by the licensing authority at the council. There can sometimes be pushback from local public health, from local police forces, but there isn't one single group or organization that pushes back. We have some police forces that are incredible supporters of us. We have some councils, some public health organizations that are very supportive, and we have others that are not. And it's simply, in my experience, a case of making sure that we clearly communicate to the people who are oppositional how we operate and what it really means to run a drug checking service, because a lot of their opposition is based in a misunderstanding of how the service operates.
Perfect, thank you so much. No, that's really good to know, and I'm really interested. Here, my internet might have cut off. No, there it is, sorry. Yeah, so just a question for Laura, some of these in your work moving forward, and are you happy for people to get in contact if they need support?
Please do, yes. Please get in touch. I saw that someone asked if myself and Guy would be able to share the slides, I'm very happy to. So I'll send that around. Guy's nodding. But yeah, please do get in touch. Did I hear you, Ellen? Did someone ask what we're working on now, or have I invented that?
Do you want me to? I'll jump into Ellen's internet. Having some issues here. So the question was, how can Release support SUs and universities in this work moving forward?
Oh, exciting. Well, that's a really great question. I know that something that we may be assisting with, I don't want to give too much away, but is thinking about specifically, I know there's discussions between Release and SSDP about perhaps something about reagent testing. So that's something that we are really keen. As Guy said, obviously the gold standard is to have the laboratory testing, but is these kits something that the university can give out or sell, but we'd prefer to give out, something that could be immediate, even though there are limitations. So that's one way we could help. But actually, you know, if anyone would like to get in touch with us, we would be extremely happy to help and discuss this further about what we can do to help. That's what we are. We advocate for the people we work with who are often drug users. But, you know, we really like to work collaboratively. Hopefully you can see, if you visit our website, a small plug, that all of the projects that we do are collaborative projects. And we're working at the moment looking at strip searches and how they are extremely unsuccessful, extremely shame producing, and are they racially equitable? I suspect not. So that's something we're working on with Forefront. So we really like to work with other organisations. So get in touch, and we would love to carry on these conversations.
Amazing, thank you so much. Okay, well, I'm quickly going to ask one last question, and then we'll wrap up for 1:15. So I suppose that the last question would be, I know that we've all sort of touched that there's still a lot of work to be done, and this is going to be a long journey. So what would you like to see universities and students' unions focus on first?
I'll quickly jump in here, Guy. I think obviously the testing is one practical step that would be interesting to consider. However, the first thing that universities can do, and you can start doing that even without, I mean, you know, the testing, the best thing about harm reduction initiatives are that they aren't that costly, but they're extremely effective. So yes, funding is a type of barrier, but a very minor one compared to the benefits they produce. But something that we can do that won't cost anything is to reconsider those punitive measures. That's something that we could stop today, to stop those formal disciplinary measures. If the option exists to have informal, no further action, which over half the institution said was an option, where we can't, you know, find out how often it's used, then let's start doing that and start institutions looking within their institutions, working with student unions and networks like SSDP, and let's start campaigning institutions and vice chancellors to repeal those formal disciplinary measures as soon as possible. That's the first thing I would say. And then we can explore that really exciting suite of harm reduction techniques, which includes drug checking.
I think I completely agree with that. Drug checking is a fantastic tool, but it requires a lot of thought, planning, infrastructure, you know, not least you have to have a space to run it in. You need to have people who are going to staff it, who are going to organize it. And I know from experience that isn't something that you can just do in 5 minutes the night before. Being able to change the attitude of an institution towards the risks that drug use presents is something that is doable immediately. There's no need for a physical space for that to occur that doesn't already exist. You know, people can do it working from home. Thinking about, is a no tolerance policy really in the best interests of our students that use drugs, both recreationally and who may have a problem with it? If somebody has a problem, if somebody is experiencing problematic drug use, is it really the best in their best interests that we expel them from the university? I think it's not. So yeah, thinking about the general change in attitude as the first, fastest, most important and lowest cost step that can be taken. It's win-win.
Thank you both so much. Yeah, I think that's a really important and good note to end on. So that wraps up our first session of the conference and our Q&A. I want to say again, just a massive thank you to both Guy and Laura for taking the time to talk to us and your presentations. I know I definitely learned a lot from this, and I'm sure our attendees did as well. And just, I suppose, a massive thank you for the incredible work that you both continue to do on this. It's really important, and it's great to see. So that wraps up our first session. I hope that all of you enjoy the conference. Don't forget to join using the same Zoom link at 2:30 for our next session, Winning the Case on Harm Reduction, which is being ran by UWE and